World Family Doctor Day is a day set aside to celebrate the immense contributions of family doctors to the healthcare delivery systems of nations across the world. It is marked on the 19th of May annually. Nigeria, being a member country, also joined in the celebration in various states of the Federation and through various activities. In Lagos, the Association of General and Private Medical Practitioners of Nigeria, AGPMPN, Lagos State Chapter, held a press conference in honor of this epoch-making event.
The World Organization of Family Doctors declared 19th of May as World Family Doctors Day. This day has been honored each year with memorable programs and activity that celebrates the immense contributions of the work of family doctors to the healthcare delivery system of nations all the world. The day of our family doctors the opportunity to reminisce not only their long journey into prominence and relevance, but to showcase the pivotal role they have continued to play in nation building and global health. The day provides family doctors with the opportunity of evaluating their performance in the wondrous role that they play as a leader and manager in the health sector, as well as inspire fresh parameters for re-calibration audits for continuous improvement. For a category of doctors whose role in patient care as well as healthcare system management are unique and unequal, this is strategic. As the most essential doctor in society, providing its most essential services to the critical mass of the population in such a comprehensive and continuous and engaging manner that none else does, this exercise is essential and immensely rewarding.
This year's theme for the event was tagged Family Doctor, Caring for You for the Whole of Your Life.
The whole essence of the World Family Doctor Day is to ensure the pivotal role of family doctors and family physicians within the healthcare system is advocated for, is strengthened, is made in such a way that everybody knows more about family physicians. But one important thing is that I always say that in the pyramid of the health system, we have the family physicians or the family doctors at the base of the pyramid of health system. Until when proper attention is given to the base, the apex will not stand easily. The apex is about the secondary and the tertiary healthcare delivery system. So we occupy the base of the healthcare delivery system, which forms close to about 70% of healthcare in this country. And it's very difficult to ignore such percentage. What I'm just saying is that the government will pay more attention into primary healthcare. Family physicians, family doctors that are specialists in coordinating care, making it a continuous, coordinated healthcare from cradle to grave. That's what distinguishes us. Because we take care of healthcare of every living from cradle to grave.
WONCA celebration also offers family doctors the opportunity to reevaluate their contribution and performance in the health sector and also reflect on the challenges facing the nation's health system.
There are quite a lot of challenges in the health sector. Number one is a lot of delays when you go to the public sector because they are overwhelmed. There is a lot of campaign against the private sector. They are quack, they are this, they are that. It is the duty of the Medical and Dental Council to run after the quacks. It is the duty of the government to run after the quacks. It is not my own duty as a private business person that started in an hospital. It is the government. So if the government is not bothered about running after the quacks, but they are there to extort the private sector that have the certificate to work by overtaxing them, by giving them all sorts of levies that are making the cost to go up, then there's a challenge. It shows that the government intentionally wants to ruin the system. You see, it's a gamut of problems that we cannot exhaust in a day. We are ready to work, but we're not being supported.
In the midst of all these, what is the way forward?
We believe if government has empowered the private sector by making sure we have a very good enabling environment to deliver health care, definitely there will be a paradigm shift. There will be a troop more to the private health sector. I think government needs to do more. They need to ensure the private sector is strengthened in such a way that it can deliver proper health care system at affordable cost to the population.
We know that the present health scheme, which was started in 1999, which is about 20 years old, only covers less than 5% of the population. So that means 95 out of 100 people are actually taking money out of their pocket to pay for medical care. And most people do not have the money for emergencies. So you have a healthcare system which is only geared towards those that can afford it. What happens to the generality of Nigerians, who are actually the vast majority of this country? The vast majority should be able to access quality healthcare at an affordable rate. And what that generally involves, as we've seen, is some kind of feasible health insurance scheme which allows them to actually access healthcare when they need it.
The message is for us to stick to the roots. The health of the citizen of this country is important. We must give them what they deserve. We must take care of children who are the leaders of tomorrow. We must not have children or leaders who are defective. And that is my concern, because if we do not do it right, we will also suffer the pain tomorrow. So we must be committed to the health of this nation.
For us to witness a change in the Nigerian health sector, we all need to change our health-seeking behavior as a people. The government needs to invest more on health, and our family doctors need to be recognized as a total doctor for the total man. So when next you are treated by a family doctor, just know that you have been attended to by a 5-star doctor.